Right, good afternoon, everybody. Professional Care Workers Week 2024, year number 6 of Professional Care Workers Week, and a celebration of all things care workers, including their skill, their giving nature, and just being willing to support people in any way necessary. This is day 4 of Professional Care Workers Week, just checking. We are on a Thursday, and webinar number 2 of today. And today with me, I have Manjeet Rai from Capital Care Group, Debbie Harris from Automina, and Sandra Drona from the Close Care Home. Thank you very much to our panelists for joining us this afternoon, and I'm really looking forward to what I'm sure is going to be a very interesting and rich conversation about the future of care homes. So let's go right into it and start with Manjeet. And could you actually tell me, Manjeet, first of all, what are you currently doing in your care homes that support care workers in their work?
In all our homes as a company, yes? Okay. So we offer them a lot of supervisions, anything to do with their mental health or how we develop their skills as well. So if somebody comes to us totally unqualified, they've never been in the care sector before, so we will actually encourage them to do their NVQs, and talk to them what progression they want in their career. So the management are fully trained to support them, and not only obviously they are on that career path, and also as soon as they are developing their skills, the salary will be increasing at the same time as well. So what we're looking for is longevity of their career in Capital Care Group. And also, compassion for the elderly is so important for them, and we actually nourish them and invest a lot into how to sympathize with the elderly, what empathy they should be giving to them, and drive that quality of care in the workplace. And also, it's all about enjoyment as well. They need to enjoy their career, and they need to have that patient with the residents and support the families at the same time as well, because the families are stakeholders as well to the organizations, because their loved ones are in our care. So really, so it's all in all, it's like working in a nice community and encouraging them, look, this can be a long-term career for you. You can become a nurse, or one day, you can, on that career path, you can become a home manager as well. So, and also the retention, it's for us as well, it's all about good longevity and good retention of their career path. And also that stabilizes our care, and it stabilizes the consistency of the individuals and good quality care for the residents at the same time. So all in all, it goes hand in hand, really, both ways.
Thank you very much, Manjeet. And Sanjay?
So I think it's really interesting because I see what Manjeet and the team are doing there. Now, we've taken a slightly different approach, only because we're smaller, we're independent, and that means that with one site, we have slightly different agility to a group, and we accept that and we acknowledge that as both a benefit and a bit of it's a double-edged sword, isn't it? So we can't afford to do certain things, but we absolutely can move a lot quicker on others. And part of that is really doing a lot, again, around the supervisions and supportive, more holistic training that we offer. So we realize that a lot of our carers are actually, we define everyone in our building as a carer. And that includes our gardener and our driver and our chefs, because they're all involved in the sector, and they're all involved in helping maybe somebody by the bedside deliver their level of care. So we've changed that, and we've actually made it a lot more specific to each individual, because we brought on an amazing deputy manager whose passion is actually, you wouldn't believe it, and people say this, and it's normally a load of hogwash, But Caroline is obsessed about supervision and training and making sure that people feel supported. So it's a lot around that. Now, the other thing that Manjeet mentioned is, again, that familial aspect and that community aspect. So one thing that we're really quite conscious of as a small family home, even though I say that, but we've got 130 people that work with us. We are a small family and it really is connected and we know a lot. So what we do is try and bring our team's families actually into the building as much as possible. We create that integrated network. And what we found is that people, because of that, feel a lot more supported. Just understanding that, you know, somebody else knows the name of their kids. Now, we extend that to the residents as well, because quite recently, I say recently, about a year and a bit ago, we created these booklets. So we've all seen the Knowing Me books that we have for residents and where we talk about a resident's life story, but we realized that 99% of the time, we're in the resident's home, in a care home, because that's their home, that's where they live, we happen to work there. So what we did is we reversed that and we started doing these booklets on every member of staff and in the staff team. And we now have those in the bedside for every single resident. Now that means that they know exactly who is around them and in their home. And what we've seen, that's created conversations and almost like the amazing work that other people do about connection and community, is our community has just grown bigger. And Lara, who works at LDC Care, said something fantastic the other day. She goes, our job is to make our residents' lives bigger. And actually that made a lot more sense, these small little things that we do, which is helping our team become part of our residents' lives. And thus their world is bigger and it actually creates that bond and strengthens that situation, again, reducing people leaving and increasing retention. So it's a whole holistic movement that we have, which is very based in our culture and our values.
Lovely. Thank you very much, Sanjay.
Could
Debbie.
I just add something to that? Of course, as at Autumna, we're an online platform. We're helping families to find the care. But I have never thought of the fact that my advice line team, because we run a 7-day-a-week advice line, they are actually caring because they are speaking to families and individuals who might need the care for themselves or a spouse or a family member. And they're supporting them in exactly the same way as, well, not exactly the same way, of course, because it's over the phone, but Manjeet and Sanjay are talking about. It is about supporting them. It's about giving them the right information and helping them on their journey, whatever that is, before we actually pass them over to the care home. It's quite interesting. I'd never actually thought about that before. So
no, but sharing knowledge, Debbie, is just as important, isn't it? Because keep in mind that 99% of people that access social care for the first time, and I think actually the metric is more about sort of 90% of people that access social care for the first time are doing it at a point of crisis in their lives. So any level of care and compassion that we can give them at that point when they're making those super tough decisions really quickly and make sure that we're effective. So that 7-day turnaround, 7-day availability is genius. And it's the same way that we like to have management present in our building 7 days a week.
Yeah.
And that's for no other reason than we think that sort of everything I thought about adult social care before I started working in adult social care has been blown out the water. Every single cliche, paradigm, thought process has been proven wrong, because everything that I expect now, that means that every other person in the community and in the population must hold elements of this logic. Now, just this week, we were with Carolina, and the minister was talking. So the Minister for Care raised the fact that there's 1.5+ million people that work in the sector, making us one of the largest and most impactful sectors in the country. Yet, what is that experience of those 1.5 million people? Because if we can change that and make that as positive as we see and we deliver across the board, couldn't that have a huge impact on the way that our sector is regarded as well?
Brilliant. Thank you very much. That's very helpful. And I hear some great stories of great practice, including from you, Manjit and Sandra, of how people support care workers in their roles. And I think, well, Sandra, you do a lot of that at the Outstanding Society, don't you? Sharing that good practice and supporting people, how to do it even better. Manjit, back to you again. Could you start us off on the question of what do you think about the current situation with CQC? Because it's been, well, quite a difficult few years, but I think especially the last few months. So what are your thoughts? You're on mute, Manjit, sorry.
CQC, as I said earlier on, CQC are law to themselves. We as providers, you know, it's a tough and challenging business to be in. It's not easy dealing with people's lives on a day-to-day basis, also making sure that your staff are supported so they are in order to deliver good quality care. CQC, what do we actually get from CQC? CQC, if you look at a provider point of view, nationally, you've got so many homes which requires improvements. They could be trading really good now at the present moment, but CQC has not really gone out to look at the homes, how they're performing. In my sort of company, I'll give you an example. So all our homes, when we get the consultants in, we do the outside auditing and so on. So it's all coming good rating. For last nearly 3-4 years, we're sitting on requires improvement, which obviously when you look at the bank point of view, you know, they are actually looking out for that you are slightly in a special measure. You know, your insurance, they want action plans. What are you doing about it? When are you going to invite CQC to come in to audit your home? You're sitting on requires improvement for nearly 4 or 5 years. So then you speak to CQC, or, you know, at the moment, there's not a designated inspector anymore. So you're speaking to a team of people with CQC. And, you know, if you say to them, okay, can you please come and audit a home? Oh, we haven't got the resources. If the home is not screaming, ranting and raving, and you haven't got complaints, you know, so there's no point us coming out at the moment. So as and when we need to come out, we'll come out. So, you know, every so often we're doing our PIR as well. So before you did a PIR, CQC will through the door within 3 months. But now they don't come. So it leaves the provider very vulnerable. So when obviously if the family is looking for a bed for their loved ones, so they go on the inspection report because it's online. So when we book into a hotel, you're going on holiday, you go on the TripAdvisor, don't you? To look at the hotels, what the ratings are. And now similar, this is what happens in the social care sector. So family will look at the report and they'll say, right, okay, this home hasn't got a good rating or an outstanding, either requires improvement. Do I really want my family member to be in that home? And then, you know, when they go around and speak to the manager or the staff, they love the home, but then they start questioning, why are you sitting on this inspection report? When are you going to get a good rating? Why can't CQC come and look at your home? When are you going to be inspected? So those are the questions up in the air at the moment. So, you know, I think this is not fair for the care providers out there. Yeah, so when you got rating inadequate, then obviously CQC will come out. But when you're sitting on requires improvement, you could be there for many, many years. And however, if you've got a good rated home and you know that that home is underperforming, so that there needs to be work done there as well. So really, I think it's totally unfair for good providers to sitting on these requires improvements and nothing's been done. So the new inspection, you know, framework system, I mean, we've got a meeting with all our managers next month, and we are looking into how to audit ourselves, so we can share those audits with CQC to say, look, you know, this is where we are sitting as a provider. So we are sharing all the information with you. We're investing into CQC Pro as well, and so on. So can you please inspect our home? So, you know, it is, yeah, it is totally unfair. All I would say is because And also on the financial point of view, you know, people will start questioning you to say, look, if you are charging, this is your base rate, you're registered for a nursing home plus, you know, it's EMI nursing, and this is your base rate. But if you look at your inspection report, it's a great improvement. Why should we give you this fee? So it's like a double whammy sword really at the moment, and those are the challenges with CQC. Olden days it was totally different. As I said, I've been in the industry over 20 years now, and those days are gone when, you know, inspections used to take place and you would announce the inspection a month before, you know, speak to all the families, clients, staff, you gear up the inspections. And over the years, obviously it has become unannounced inspections, which we haven't got a problem. And because we like to know as a provider, where we are standing on compliance wise. If it's, you know, if we are good, you know, it's really good for us. If we are underperforming, where are we sitting on that platform with CQC, and how can we improve to get to outstanding or to good rating?
Thank you very much, Manjeet. And not the first, and I'm sure not the last time this year that I've heard that people are just waiting for so long, especially when they want to show improvements. Sanjay.
There's exactly what Manjeet has said, but there's also the reverse. Now you've got a home under the right leadership, which are doing brilliant things and need to show that upward trend. But keep in mind, if your work requires improvement, say 4 years ago, there's nothing to say that, again, that the whole situation hasn't become disenchanted. People haven't lost that, you know, people have lost the motivation, because these one-word inspections are, you know, can be damaging. They can be very productive, but it can have such an impact on a service that what's to say that that service, they got the request improvement, everyone knew they were doing better, but it just was a bad day or it was a bad inspection. And, you know, the challenge process isn't really the most effective. But there's loads of little processes and bits in between. So if they've gone and they've experienced it, like they don't want to be in a home that requires improvement, they've left, what's to say that that home isn't now inadequate? Or where it was good, it's dropped down, or it was outstanding and it's changed fundamentally. Now, so there's 100 little steps in that. The bit with the CQC at the moment is the preparedness around providers. Of course, when a plane goes by, but it's when the preparedness of providers to support their teams around the single assessment framework. The fact is, the framework is here. We were told it was coming. They made it very clear it was in place. I see providers on a day-to-day basis that are not ready to be inspected. Why? We're challenging them to say, but the other thing is, keeping in mind that we've just said this, that every single person in your building and technically your circle of care can be considered a care worker or is a care worker, in the same way that you guys will support, you know, somebody in our kitchen team if they approach you for support, because they're considered care workers. So we need to take out the single assessment framework from the manager's office, from the head office, and empower our teams to know it, because understanding your regulators as every single person on the floor, and we actually have a mandate as service providers, be it domiciliary care, be it care homes, wherever you are, to teach your service users about the regulators as well. Now, where are we doing that? How are we supporting them to understand what the regulations are and what they mean, and how they're supporting them in living their lives or delivering their roles? So we have a big thing where we take out the single assessment framework from our offices and share it across the team, so the team actually own those quality statements. And the quality statements are, once they're really clear, they understand what they're delivering and why they're delivering it. They're very, very clear to understand, actually. And we all know this, that our teams are a lot smarter than a lot of people give them credit for. So let's support them in owning that and doing the work around it, because then on the point of inspection that we called for so vehemently, we're ready to go. Because we present, and Carolina and Debbie and, you know, Andrew, we do this thing every other week where we're speaking to people about good care and good care provision and having discussions. And I'm forever shocked at the lack of engagement from managers around the single assessment framework and understanding that it's what we're measured by today. It's not our choice. So support, that's my opinion on what we need to do. The fact is, I think at the moment that we're going through a very interesting transition phase between, especially with the Penny Dash report coming out, that'll be a huge one. The Sally Warren's report coming out. There's a couple of really interesting bits of government work that's going on, which will really help us frame it. And interestingly, that would be a really good response to families who are looking at homes going, actually, outwardly, the CQC have told us that they're failing. It was in an email the other day. We all agree they are. Fine, that's not the debate. But the question is that they've told us, but have they told the world? Because that bit where they tell the world and tell the population at mass, so when they come into Manjeet's home and say, why are you here? It's like, actually, it's already understood that they're underperforming. So for the minute, look and see with your eyes and experience the home and that you feel and the care that you receive. Don't look at that piece of paper for now, because that's going to fundamentally change. I don't know if that helps.
Very helpful. Thank you. I think the point about inspection isn't just the manager's responsibility or the owner's responsibility is very important. When I used to be a care worker, nobody ever talked to me about CQC until they knew CQC were coming or it was happening. And there was a very frantic, panicky call. Oh, CQC may call you because they asked for some care workers' phone numbers. Make sure you to say this, don't say this. Bye. That was it. That was all what I was told by the company's work about CQC. And then I had to dig myself to actually understand who they're talking about. Why is it such a big deal?
Imagine if you didn't have to be told what not to say.
Well, exactly.
Yeah.
Like I always had found it incredibly questionable and unethical to be told, oh, don't say that. I think that's quite telling. So yeah, everybody should be involved and everybody should be comfortable and in a way, like you, Manjeet, said, welcome it, because if you're doing something wrong, you want to know it, but also you want to know that the organization that judges you whether you're doing things right or wrong is actually within itself the right organization in the good shape to be doing it.
I want the same candor that I am. Basically, I want the measuring stick to be held up to them.
Yeah.
If that makes any
Yeah.
sense.
No.
But the same requirements that I'm asked to perform to, I'm like, great, can you do that before? In the same way that if I ask any single member of my team to do anything in our building, in our service, I am confident that I could do the same thing. Other than the very complex things around medication, and that's a very strict nurse's responsibility or somebody that's medication trained or such. But if I'm going to ask you to deliver care in a particular way, it's because I know I could do it my way, and that's our way. That's our value. That's the close way that we set ourselves that high bar. I just query whether they're able to do the same and then say that they deliver. Yeah,
no, I agree. Debbie, from your point of view, and then you've started some interesting things this year, would be very good to hear about that.
Yeah, sure. So obviously we come at this from a slightly different perspective than a provider. I speak daily to providers, and without exception, everybody is pulling their hair out about the CQC. So, what are my thoughts on the current situation with the CQC? I don't directly have to work with them, but I speak to lots of people who do. And I think it's fair to say the sector is not happy with what's going on. You're paying for a service and you're not getting a service. And I think that's the bottom line. But when you then look at the value proposition, if you like, of Autumna, we start from the care sector perspective, from the care seeker perspective. So everything we do starts with, what does the care seeker need to know in order to make an informed choice about their care? Well, the first thing they need to know is whether or not a care service is inadequate, requires improvement, good or outstanding. They need to have a regulator overview. And as Wes Streeting said a couple of months ago now, the CQC is not, the report is not worth the paper it's written on. It's no good. And I think James Bullion said at a conference a couple of days ago, the average age of a CQC report is 3 years and 10 months old, which is absolutely useless if you are a care seeker looking for care. So about a year ago, we started working with stakeholders in the sector. So Care England, Care UK, Person-Centred Software, Virgin Money, Stephen Scown, University of Kent, Lang Buisson, stakeholders from different perspectives who had a different view of the sector. We wanted everybody's voice. And we got together and we said, right, what can we do that will give the care seeker an at-a-glance overview of the quality of care and service in a setting in real time, and also give the care provider the opportunity to present their improvements and the changes that they've made in real time and actually get an ROI on that, get a return on their investment for improvements. So the overall is that quality of care goes up. But we started working out what can we do to create this product, if you like. So we launched OpenScore 2 months ago. OpenScore is the result of those conversations and those meetings, and it's a data aggregation of over 60 data points. And within that is the CQC. So it's made up of sort of 3 sections. The first section are APIs. So these are feeds that come directly into OpenScore. So that's the CQC, it's the food standards rating, and it's the registered manager. So that is an automated feed in. The second section are self-assessments. And these are self-assessments because there isn't a database anywhere of this information for us to pull it from digitally. And that covers IPC, ESG, and food. The third section is about information the care seeker needs to know to make that informed choice. So it's about the information on the care home, including things like prices. So those are your 60 data points. We've launched version 1. We believe this is going to be quite a long-running project. And we already have 2,000 care providers using it. Every provider I've spoken to has said, this is what we need, because this is updating information all of the time. It's feeding it into OpenScore. I would clarify, OpenScore is an independent product to Autumna. It sits on a separate website, and it's an independent product. And by the end of next month, by next month, you won't need to be working with Autumna to be able to get OpenScore. It is available to everybody. We just used our care homes that we were currently working with to get it set up. But I've been really, well, I've been relieved, it has to be said, at some level, that every provider I've spoken to has thought it's a good idea. And, you know, why haven't we done it before, really? So we have done it. We're working on it. We're moving forwards with it. We're open to any suggestions, any comments. We're totally agnostic on who we work with. No barriers. We just want to get this right from everybody's perspective. So that's what we're trying to do. I don't think we can wait for the CQC. I don't think we can wait for the government. I think the sector just needs to get on and do stuff. If we recognise we've got a problem, we have to move forwards and try and solve it ourselves.
Thank you, Debbie. And just to clarify, you said it is an independent product from Autumna, but Autumna reviews feed into it?
No, we don't have reviews. So we work with PCS and Mediabase and other digital receptions. So, you know, the digital reception where you sign in rather than write in a book when you go in and come out. So anybody who has that product, we will work with you. And when they leave, you leave a review. That feeds directly into OpenScore. It feeds directly into a premium listing on Autumna as well. But it feeds directly into OpenScore. We can't use the things like Google reviews because we can't verify them. So long as somebody has just been in the care home and they're signing out, then we've got that verification that we need and that clarity. And we are seeing via these digital reception products, and e-reception is another one, we're seeing really large numbers of people leaving reviews. So as an example, I was looking at one this morning, 79 people had left a review in the last 30 days for one care home. So these are significant numbers. And what it does, if you're looking at that large number of people, you're getting an objective overview of the quality of that service. And I think that's what we need. We don't need particularly subjective. If you're choosing a care home, you don't want somebody's personal opinion. You want an objective overview of it. That's my view on it. But yes, that feeds into Open Score.
Yeah, I think in terms of reviews, volume matters, doesn't it? Because it gives
I
you
think so.
a full view.
Yeah. Well, otherwise you could have somebody who has had a very bad experience, and that is not helpful. But if you've got one person who's had a bad experience amongst 71 who've had a good one, then you're getting that objective overview.
Okay, thank you. Right, Manjeet, over to you again. With the new government in place, and at times it feels like a week, at times like 5 years, but it has been 2 months and a few weeks of actual work with Simon Rees in place. What would you like to see in terms of social care reform around care homes? You're on mute.
Hi there. Sorry about that. Well, social care obviously needs mega investment, as you know. So, you know, the local councillors, whenever you approach them, and the local councils as well, all the commissioners, we haven't got enough money in the pot. Therefore, you know, few of my homes are almost, I would say 95% social services run. We hardly get, especially in Stoke, we hardly get any private clients there. So the challenges are, we've got no money in the pot. You know, so if you go to the ICB, we've got no money. If you go to local authority social services, we've got no money. So any business, you have to have the income coming in. And then the challenges are, if you're not paying your staff good rate of pay, they will go somewhere else. They're gold dust at the moment, and so on. So they've got, you know, all I would say is we need a lot of support. We need a lot of big investment, cash injections into the business, so social sector gets into, you know, people start rewarding our business, what we do. And in the local community, you need care homes. You need people like us to drive the economy as well. And where would they go? If single operators, just imagine, you've got a single operator now, the challenges are cost of utilities is enormous, cost of food is enormous. Everything that you need to run a home is expensive exercise. The cost of care analysis, the list is so long that you think, okay, God, you know, where's this money coming from? If I'm not going to get in the fee that I should have to give my staff their salaries and put food on the table, and rest is all the equipment, everything that I need to have to deliver care, if I can't survive in this sector, obviously I might as well just hand the keys to the bank manager. So that's where, you know, and I know a lot of family, a lot of friends who are suffering with that because they only got 1 or 2 homes. So when you've got a group of homes, yes, if 2 or 3 of your homes are doing well, they are supporting the underperforming home because financially the cash is not there. So to me, that's where the challenges are. So let's see what the new government, what they bring in to the table, really.
Well, so one of the things that they've mentioned is a national care service. Any thoughts on that, Manjeet?
I don't know much about that, really, national care services. So
No, nobody does. It's been thrown around as a term, I think, as a suggestion of let's do it. Nobody's got any detail. But I think, you know, the general idea is trying to bring social care under a joint banner similar to the NHS. Sanjay, what would you like to see from the new government?
The truth is a lot, but what they need to understand fundamentally is the fact that 70% of the industry are independent providers.
Mm.
Small 1, 2, 3, up to I think 5 home groups. Now, if that's 70%, they have to communicate with that 70%. Now, quite often I find, the big groups get really lovely time in very big rooms, talking to them, and I'm like, but they're only 30% of our sector. You don't engage with the rest of us. And it's the challenge is exactly what Manjeet was saying. You think we have to be operationally excellent and outstanding and perform at such a level with all of these things. Realistically, every mandate of training and the new requirements against us. Today, I'm actually at a conference for IDSI, so the texture modified diets, and explaining to them how we do things at the close. Now, all of those things we are able to do because we're agile, but we're also prevented against because of, again, the rate. So one of the things I really want to see is central government holding local government to task on wasting money, because I see local government waste. So your commissioners, the people are, it is boots on the ground, but the local ICBs, I see so much waste in ICBs of funds, and I'm thinking half of the time it's jobs for the boys, or protective. There's so much protective behavior there. Right, you need to really just crack down on what's going on, where's money being wasted. But then again, the next bit is we set up these ICBs, and now we've asked the regulator, who's already stretched, to now regulate them as well. So at what point, we're setting up the system to break when it comes to things like a national care service as opposed to the National Health Service. It sounds great in terms of parity. However, we know that because our sector is seen as a private provider to taxpayers, that level of institutional appreciation and love it's almost impossible. It really is, because GPs have gotten away with it, because GPs are exactly the same as most care homes. They have contracts with the local authority. They're private providers into the NHS. But that's because everyone will access a GP at some point. Now, whilst we appreciate that everyone is going to at some point be accessing adult social care, especially with the way that the world's going and the way the illnesses are changing, and people's presentations, where is that appreciation for what we do now, and how is that going to build in? I think the educational piece around that is a much more complicated dialogue, and that sits around people really being able to respect adult social care workers across the board, people understanding what it is that we do, because it's not just, every intervention isn't personal care around incontinence, because that's what everyone thinks, but they can be really engaging, really important interventions that really just celebrate life. And I think that's the bit. So is there a lot more work that actually needs to happen at a pure educational level around what our sector is? Yes. And is that Department of Care or Department of Health and Social Care working with Department of Education to really strengthen up that process of what it is that we do, and getting people into care homes and seeing them and doing things around that? Yes, there's scope for that. I think there's a lot around that, and it might start the ball rolling. The problem is there's 100 balls that need to be rolled at the same time.
The 100 balls that have to go at the same time, that's absolute agreement. And for a long time, I've been a champion of getting kids to the work experience in care for 2 reasons. First of all, I think unless you experience working in care, it's very difficult for people to understand what a rewarding role it is and how amazing it feels to support people, and for them to realize it's something they want to do. But secondly, is to educate the wider society about what this actually social care does, because people still don't have a clue. It boggles my mind, but people still don't know. They make terrible assumptions as well.
Hold on, but try this, Carolina. Even people studying health and social care at college don't have the right exposure to care homes, nurses going through their degrees. You know, we've had this huge debate with the SNAC, so Social Care Nursing Advisory Council, last week, and it was about trying to explain it, helping them understand that actually social care nurses are as qualified. In fact, they're delivering nursing, you know, care homes and services within adult social care are generally nursing-led care. There's autonomy, there's experience, there's skills that are different, not lesser than working within a ward in a HDU or an ICU or, you know, respiratory care, whatever it is. Our work is just so different, but as meaningful. And it's really interesting because still nurses are seeing, you know, oh, you don't want to go to a care home, that's where, you know, your career goes to die. And actually, it's actually where your career goes to live, because the way that there's so much autonomy there, it's such an exciting place. So I think there's a lot around education, and the local skills improvement plans are working as well. But the industry has to also, it's double, what is it? It takes two people giving a handout, if that makes it, or two to tango, it's maybe a better one. But it definitely means that people have to very, very much get involved in saying, you want to come, that's great, our doors are open, so get involved.
Lovely. We just have a message from Chris Powell in the chat in terms of a link transitioning from nursing to care home nursing, so acute NHS nursing to care home nursing. So thank you very much. We'll share that as well. I was giving, it's quite a few, before COVID, I was giving a lecture at University of Sheffield a few years back to health and social care students. And like you just said, even those who study don't understand it. That it was like speaking to people who had no clue. Number one priority was risk assessment and risk aversion, where in social care what we try to do is positive risk taking. And it was all so medicalized. I honestly couldn't, like, if I didn't know I was speaking to students who are supposed to be about health and social care, I wouldn't have known. So yes, that was quite striking. And you're right, Sanjay, like social care nurses continually get, you know, disrespected by their colleagues in the health service and treated like they're worse or less qualified, none of which is true.
We had some great advocacy from Andrea Sutcliffe when she moved from CQC to the NMC, so the Nursing and Midwifery Council. She did a lot to raise the exposure. So the RCN have been doing some great work as well around that, and that was really impressive. But here, this is, I'm sorry, I'm just taking it. I don't know what the next question on your list is, but to throw something out there about the future, I am seeing in our service, because of the choices, not that I agree with them, but the choices being made by local commissioners and local authorities and government on the way that people are being sent home or domiciliary care and the way it works. People coming into care, absolutely, maybe at a slightly different rate, but at a more complex stage of their diagnosis and their life. Now, the future is then giving me a sign that our teams are going to be asked to do so much more. And I know that's not a proper grammar, but just roll with it. But we're going to be asked to do a lot more around the way that we support people, the complexities of the challenges that people live with, and the needs that we support them with are going to be so different and so more developed that previously maybe we were able to support people in the early stages of their illness, and we were able to grow with them. People are going to come into us at a very different level.
Yeah.
And what have we done around it? What have we done around our teams, our people, the building and the service around them to provide that level of care or to support them in being able to deliver phenomenal care? You know, but as I'm looking at this massive event today for caterers and people in providing, you know, special food for our residents, how equipped are they with space to create INSEE meals? Or, you know, where's the sideboard in our building to test the fluid level of what level it is, whether it's 4, 5, or 6? Do we have that infrastructure ready for that? And I don't think we are. And I don't think that we're good enough at supporting our teams to give them the right tools. Because we get blamed, and we will pass on that blame, unfortunately, and it's a human trope. But what can we do around making sure that people are ready for that future? I think we need to also look at now, but also be slightly more forward-looking and think we need to be ready for that next bit.
Well, help people be ready in terms of training, supervision, etc. But pay people properly for suddenly taking on a lot of clinical nursing duties as well, and the funding.
And even
Sorry.
But just the mental awareness.
Yeah.
Just the mental awareness of actually this is, you might own a residential home now, but the way that the definition that we're not in control of what people want to class as residential dementia is physically changing. We know that is I'm seeing people being banded wrong on a daily basis, and that's because local authorities are trying to save money and they're banding people, which fundamentally goes against looking at someone in an individual basis. But the bandings are so off that how are you able to provide that level of care within that price, as well as, but also support your team members just physically with pay, but also the reassurance and the mental objectivity that this is a good career is a really interesting discussion.
Yeah, and there's been a lot of discussion around delegated health tasks that have been happening for years. They were made more official last year in the light of COVID, etc. But it is the clinical supervision bit as well. Like, if people are taking on so many clinical tasks, how do we support them with that supervision? How do we actually make sure that they feel confident and safe with certain interventions? So like you say, none of it is it isn't coming in very slow steps so you can prepare and everything else. Often it is like there is nowhere else for that person to go. You suddenly have to take on that package with all of those needs, and it's on you and your team to make sure that all of that is met in the right way. And Debbie, over to you in terms of your asks for the new government.
Yeah, so again, I come at this from both the care provider and a consumer perspective. And the biggest thing I would like the government to sort out is hospital discharge. I think it is an absolute criminal scandal what is going on at the moment. And we actually did a report. We went out to care homes, home care and living care across the UK. And this was only in June. And we asked them what their experience of hospital discharge was. And 93% came back and said, we would like it changed. We would like the process changed. 93%. I think it's fair to say, we actually put the report forward for the the Lord Darcy review last week. I think it's fair to say that bit of the NHS is broken, and I think it will take government to fix it, to be honest, the will to fix it. I think if we can sort out hospital discharge, that will go some way towards supporting care providers, 40% of whom never receive a referral from their local hospital. So, you've got hospitals that are diverting clients, and I don't mean contracted clients, I mean any referral ever. You're getting a lot of providers who are not receiving those inquiries. And I know Jane Townsend talks about it for home care. It's a particular problem there. The organisations are going bust. But I think for the care seeker and the patient, the relative, is really being given a bad deal if they're not supported to get somebody out of hospital and out of hospital quickly. So for me, that would be my massive ask, and I think it is a massive ask for the government to resolve. That's what I would like them to resolve. And then the bit about the National Care Service. Well, I would like my view, as you said, there's no detail about it at all. But could we not use it in the same way as the National Health Service is used, as an umbrella for all these thousands of organizations, this huge workforce, this huge number of people that it is affected by social care. So the NCS and the NHS, and that would that give us some parity? So an umbrella opportunity. That's what I would think potentially for a national care service.
Thank you very much, Debbie. We have a few minutes left, so if anybody has any questions, please post them in the chat or in the Q&A section. And over to Manjeet, over to you. Do you have anything else that you'd like to add about the future of care homes?
Future of care homes, as good providers, obviously the future is there for, there's a need of care homes everywhere really in the country. So all we want is support from the government to make sure that we are supported. Otherwise, it's hard to employ people. It's very well increasing the minimum wage all the time, but also, you know, providers like us, we have to have the income coming in to pay good salaries to maintain our staff, that consistency, stability in the care home environment. So the quality of service is there, and anybody comes to our sector, they enjoy the last journey of their life, and you know, and also the family, they enjoy visiting their mum and dad in the homes where the service is all met. So that's what I like to see.
Lovely, thank you. And Sanjay?
We sound like it's been quite doom and gloom, but actually I see phenomenal bits of practice every day. And that's just at the close. No, I'm joking. All across the sector, I see some amazing things going on. And I think part of the future is that we recognize how good we are, and how good we can be. And we celebrate ourselves as much as we sort of want the respect to come to us. It kind of starts from within. There's just only because it happens randomly. There's a really famous drag queen called RuPaul, and she says, if you can't love yourself, how are you going to love somebody else? And in this situation, it kind of works to us. If we can't celebrate our own skills and our own ability of everyone that we care for and the way that we do it and the people that provide that support, how are we going to allow others to see that respect for us? So part of my challenge for the future, and even ourselves, is when sometimes we get stuck on these thought process of what's going to happen, is actually what can we do to help lift everyone up? So I think there's scope in the future, and if we try, I think it's potential. So it's our destiny as much as well. So let's not be pushed down. Let's stand up and everyone go together.
Thank you very much. And Debbie?
So I'm looking at this from a slightly different perspective. So we work with the care home sector, and we also work with the retirement living sector. So the future of care homes, I totally agree with what Sanjay has said. And Manjeet, that acuity is going to increase within the care homes. But I think that is also being exacerbated by the fact that the retirement living sector is starting to nibble away at the lower level care, and to as they are developing their apartments and their assisted living, etc., they are bringing in care, and they are encouraging people to stay there for longer. And there is definitely a movement in that direction of not losing your resident. And so I think that will also push up the higher acuity in care homes.
Very interesting. Thank you very much to all three of you, to Manjeet, Debbie, and Sanjay, for your time today. Thank you to everybody listening. Like I mentioned before, this has been recorded and will be shared on YouTube, hopefully next week, if not the week after. I really appreciate you sharing your knowledge, expertise, and opinions, because opinions in every conversation, I think, are very important. So yes, thank you very much. Have a lovely afternoon, and thank you to our panelists again.
Thank you.
Thank you.
Bye.
Bye.